Hi everyone. So the next set of acid-base balance we want to explore is metabolic acidosis and metabolic alkalolysis. Okay. With metabolic acidosis, this is when the body is making too much acid, okay, and then it's losing base by carb. So it's making too much acid, losing base. Some of the common causes will be DKA, diabetic ketoacidosis, kidney failure, severe dehydration, okay, because what happens with severe dehydration, that is, it causes the body to lose base, okay. So some of the nursing priorities, no, again, you want to treat the underlying cause. What is causing the metabolic acidosis? For metabolic issues, we are directly looking at the kidneys, okay. For respiratory issues, we're looking at the lungs. For metabolic issues, now we're looking at the kidneys. So what is actually causing the metabolic issue? If it's DKA, then we treat DKA, okay. So you notice now that here, IV fluids, right? Remember what the treatment you did for DKA, that applies here, okay. We're replacing electrolyte. If it was an electrolyte imbalance issue, then therefore we'll be replacing electrolyte. So now what will your ABGs look like? Your pH will be less than 7.35. Your bicarb will be less than 7.22. Normal bicarb is 22 to 26. Some textbooks say 28. So less than 22 for bicarb. And then if you notice, it's equal, right? pH is low, bicarb is low, so that's equal. When we use the Rome method for metabolic issues, they are equal, okay. So now metabolic alkalolysis will be directly opposite from metabolic acidosis, okay. Metabolic alkalolysis, now this is when the body is making too much acid, and then or the body is gaining too much base, okay. Common causes will be prolonged vomiting and overuse of antacids, okay. The body gains too much base, overuse of antacid. Some of them, so again, we want to treat the underlying cause, okay. If it's overuse of antacid, if it's vomiting, we want to give something for anti-nausea, Zofran, Phenergan, whatever nausea medication you have available, you give it. If the patient is overusing antacid, then of course we want to educate. If electrolytes imbalance, we want to replace those electrolytes. Then what will your ABG look like? Now pH will be high because it's opposite from metabolic acidosis, so pH will be high and bicarb will be high. Again, you are seeing metabolic issues equal, respiratory issues are opposite, okay, if you are using